882 6PR. This is Simon Beaumont.
Dr. Adrian Catt rejoins us from Advanced Dental Artistry in West Perth. He's very experienced, Adrian. He's got more than 24 years' experience. It's interesting, he looks like he's only 19. Adrian, you're very youthful. You've got beautiful teeth, a beautiful smile. Thanks for coming back in today. We're going to talk about dental phobias today, and you were just telling me off air that first phone call people make about their teeth, it's actually quite traumatic for some people, isn't it? We just want people to ring guys like you and at least have a chat, don't we?
Yeah, I think one of the biggest things actually is the first phone call, because people have been thinking about their pain, their anxiety and all the problems they've had for years. This is not a short-term thing. This is something they've been thinking about. It's affected them every day. Every time they look in the mirror, they're always in pain. They're always in this discomfort. They can't chew. When they go out and eat, everything is their mouth and their teeth are affecting them in everyday living.
It's amazing. It's amazing, isn't it? So we're going to talk about phobias now. Is it just that people don't have the information, or they're not sure what to expect, they're worried about more pain, or is it a pure phobia of the work that you people do?
I actually think the biggest thing is history. They look back on their childhood, they walk into the environment, and the old dental practices used to just smell like dental practices.
Yep.
Then they hear the drill, and it's the whole conditioning that they have. And unfortunately, and you probably had the experience before, where you walk into an environment and all the memories come up. You just walk into an environment and you may not be doing anything at all. You might just be having a chat, but the environment, the smells, the sensations, straight away it brings you back to your childhood, and they think straight away of all the bad experiences that they've had.
It's incredible, isn't it? Isn't that amazing? That well, let's see what Pete's got to say. Pete has phoned in from Rockingham. Good afternoon to you, Pete. How you going?
Hey, g'day guys. How you going?
Good, thank you.
Talking about phobias with dentists. Last time I went was in 1981. And
1981.
Come
on, Pete.
And no, that drill noise you played, that put shivers up my spine. But they had this big silver needle, looked like a can of Mortine, with a bloody spike on it that looked like that hooker bloke could use it for pole vaulting. The dude could have shot me in the gob from the next room. But and mate, it's just crazy. You know what it reminds me of? That show Little Shop of Horrors.
Yeah, okay.
With a crazy dentist, It's like dentists are just all... I'm sorry, mate, if you're a dentist, but you're all psycho.
Well, thanks for the feedback, Peter.
Hey, Pete, 1981, how's the teeth?
Hey?
How's the teeth? 1981. How's the teeth going?
Yeah,
How are you looking?
Good. I can still bite a rope and get swung around like a bull terrier.
No, thanks for your call, mate. So there you go. That's it, isn't it? The noise, the silence, the sound. So we want people to make a call to yourself and to your colleagues, to Advanced Dental Artistry or your colleagues, because dental practices and rooms and staffing have changed, right? The whole management's changed. Tell me it's changed, Adrian.
Dentistry's changed in a huge way. And I think the most important thing is really getting the patients in, listening to their problems and their phobias, because we've got some patients that can't even have the most simplest the dental procedure. It could be a simple clean without actually being asleep. We've got techniques now where we can actually make the patient feel comfortable, and it could be just the environment. It could be putting the patient to sleep while doing treatment. And it's not what you're having done. It's really how anxious you are and just making sure the patient feels comfortable.
Fear is a survey by the British Dental Health Foundation. 36%, so over a third, who didn't see a dentist regularly said that fear was the main reason. So Pete's obviously got those fears and phobias from when he was young. What would you say to Pete, who hasn't had his teeth looked at since 1981?
I think the most important thing is to actually get an assessment so you can actually see whether it's affecting your general health. I mean, we know about gum disease. We know about the problems with gum disease and general health, from heart disease to diabetes to all of these problems. And it's just really important. If you want to take care of your general health, you've got to take care of your oral health. Yep. Do you have any phobias at all, Simon?
Not really. I find... So I go to a dentist in not far from here, and he's very good, and his staff are very good, and they have a good chat to me. So, I do. A long time ago, I was in Newman, and there was no dentist there, and I had to drive to Port Hedland to go and see a dentist because I had an abscess, and it was incredibly painful. So I do have a phobia about that level of pain, because the nerves that are in your jawline and through your face are incredibly sensitive once they get disturbed, aren't they?
Yes, and I think that's one of the issues is that the area we're working on, it's not like a toe or a foot. We're working on the mouth. The mouth's a very intimate area, and it is very, very sensitive.
Yeah.
So it's an area that we've got to take a lot of care of and really make sure that the patient's comfortable before we even start.
Dr. Adrian Katz with us today. Adrian, mine was from sports drinks, so going out on a long bike ride and drinking Powerade and all those things, and not flushing your mouth out with water, and end up sort of decaying the teeth. And I reckon a lot of people, if they overuse sports drinks, have dental problems. But recently, I've gone to a dentist who's looked after me a bit. He's got a little TV. You lie back, there's a TV above the thing. It's always on Channel 9. Always on
That's
Channel
actually
9.
a huge thing, is distraction. I mean, if you go to a dental practice, and everyone's got a slight anxiety, if you put a pair of headphones on, you've got really good movie on or something to listen to, that just takes your mind off the whole procedure. And most of our patients, that's enough to actually just make them comfortable.
Yeah. Dave has phoned in. Good afternoon to you, Dave.
G'day.
Hi, mate. Go ahead.
I'm normal as anyone else who have a bit of a fear of the dentist, but at 62, I've managed to conquer a little bit of it. But I'm now come to the stage of life where I've got to have dentures. And I tried about 12 months ago, and when they put that, like, plasticine in your mouth, I really start gagging and I go to throw up. Can that be done while I'm asleep? Like, can I say to my dentist, can you give me some Twilight stuff and put me La La Land while they do it?
Definitely, Dave.
Twilight stuff. Well explained, Dave.
I think one of the issues is that, again, mouth's very sensitive. Some people can't even put their toothbrush too far back in their mouth without gagging. If you're taking impressions or you're putting a mirror in someone's mouth, again, you've got to be responsible and really listen to what the patient wants. And it is. We've got some patients that need, as I said, very simple dental procedures, are clean, and they decide that they want to get it done while they're asleep. You know, it's the most important thing is just tailoring the type of anxiety the patient has and making sure that you do the treatment while the patient's totally comfortable.
One of the other things I've noticed that's changed is my dentist will take some pickies and take some imagery and get some imagery and show me on the computer screen. You know, say, now have a look at this. This should be here. This should be here. We're a little bit worried about this. This part of your jaw is okay. I'm not too worried about this. And they take you through a fair bit of prep, which is what you guys do too, right?
Yeah, the most important thing is communicating. I don't think people can understand if you flash an X-ray up or something. Patients do not know how to relate to that. They've got to see something. And I think that communication is very important. You're always building trust with the patients. And it's really important for them to actually know exactly what's actually going on. Make sure that it's clear. Make sure that you get feedback from them before you start any treatment.
Yep. 9221 882. Do you have a phobia or do you have a question for Dr. Adrian Catt while he's here up until 2 o'clock? Give us a call. I thought we might get this particular issue come in. This is an SMS from Phil. I'll paraphrase this a little bit, Phil, if that's okay. One of the experiences of a visit to the dentist is the bit where you go out to the cashier later on. That could be a little bit of you can develop a bit of a phobia about that part, can't you?
Yes, I think money will always come into any business, and it's something that needs to be discussed for sure.
Yep. Talk about plans, options.
There's always plans and options. There's now the ability to actually access super in order to pay for chronic dental problems. So a lot of patients now that are getting major dental procedures done where they can't afford treatment, of course, the super money is, of course, their money, and they're using super now to actually, or accessing their super in order to actually fund treatment. There's also financial companies we work with, and of course, we also offer an in-house payment too as the last option.
And the treatment that you're receiving can be X, Y, or Z, can't it? There can be the simple one, the deluxe one, and then the mega deluxe one.
Yeah.
Go and see. You guys have complimentary discussions too, don't you? You have a first up discussion with people.
I think that's really important. You got to find a place that you feel comfortable and it fits right for you. So complimentary discussions are a way that you can come in, have a chat to us, and then we can organise appointments from there on as long as you're comfortable.
Adrian and his team are at 555 Newcastle Street, West Perth. This is the number, folks. Have a think about this. Maybe give Adrian and his team a call. They do have complimentary discussions, and if you haven't been for a while, like Peter of Rockingham, you need to consider it because your oral health and your general health is incredibly important. The confidence, the lifestyle, all the benefits are significant. 6165 3888, 6165 3888. Tim's phoned in. G'day, Tim.
G'day, guys. How you going?
Good, mate.
Hi, Tim.
I'd just like to say there's been nobody more scared of going to the dentist than me, to the point that I used to be able to walk up to the dentist's door and I would just break out into a sweat. And years later, having to take my daughter to the dentist and saying, look, they're really great people, there's nothing to be scared of, and stuff like that, she sort of put me on a spot and said, well, Dad, why don't you come too? And I was shamed into going to see the dentist, and luckily we've got a really good guy in Kalamunda who is an absolute giant of a man, and he's got big hands, but his name is George, and we have a nickname, Gentle George, and he does the most amazing job. And since then I've had quite a bit of dental work done that has been needed to be done over the years, and he's an amazing bloke. So it is all about the person doing the work and how they look after you.
And the techniques have changed, haven't they, Tim? So shamed into it by his daughter, and now finds that it's not as bad as he remembers. G'day, Craig.
G'day, Simon.
Mate.
Simon, I didn't have a phobia. I had absolute fear. Our dentist, when I was a kid, I'm 70, so when I was a young bloke going to see the dentist in a very young age, he believed in not using anaesthetic at all, including drilling, the big drill and those big belts that go round and round and round, and then the high bits. Mate, I've never given birth, but I reckon it was more painful than giving birth.
Wow. Times have changed. When was the last time you went, Craig?
The last time I went to dentist was about 2 years ago.
Yeah. But, all right. So you're just about due for another one, hey?
Yeah, but these days, of course, they don't hurt you like they used to. But honestly, the pain was incredible, and you had to sit there and suffer it and not complain too much. But I remember as a kid, it was just dreadful.
Yeah, thanks, Craig. Good to hear from you. We all recall that film from that particular movie where it was actually used as a form of extreme discomfort to get information out of people, the boys from Brazil. Adrian, complimentary discussions, people can come in and see you. I didn't realise how deep this fear runs in people. It's amazing, isn't it?
We see patients that will wait till the very last minute when they've got no options and their teeth are basically rotten to the stumps, but they're in so much pain and it's affected their life so much that they finally come in. And they're the patients that we can make the most massive difference to. It changes their life, it changes their health, and really we get to the point where, we can either give them a new set of teeth or we can restore their teeth. And I think once they get to that position, then dental visits are actually very easy, of course, because then we're just doing preventative care. Yeah,
it's changed, folks. Go and see the dentist. Advanced Dental Artistry is Dr. Adrian Catt. It's on Newcastle Street in West Perth. I'll give you that number again. They do have complimentary discussions, but both Adrian and I would encourage you to go and see your dentist. 6165 3888. Thank you, mate. Really enjoyed it.
Thank you very much.
Great chat today. Thank you for talking to our listeners. It was excellent. 92211 882. We're going to take a break. It's 2 minutes to 2. When we come back, Trevor Long will be with us talking technology.